All right. Thank you so much, everyone, for joining us today. Today's webinar, titled The Role of Climate Change in the Spread of Vectors and Vector-borne Diseases in Windsor-Essex County, is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. Our webinar series aims to explore current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. My name is Maddie Schuler, Project Officer with CPHA, and I will be the moderator for today's webinar. Before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. I want to take a quick minute to show everyone the winning posters from last year's Infectious Disease and Climate Change Grade 6 poster contest. This was an opportunity for teachers and students alike to learn more about climate change and the impact it is having on the spread of infectious disease like Lyme disease and West Nile virus in our communities. So students across Canada could submit a hand-drawn poster to bring attention to a climate-sensitive infectious disease for a chance to win a Chromebook and other great prizes. So on your left is the national winner from last year's contest, and on your right is the national runner-up. And you can actually see all 8 winning posters from last year's contest as well as the previous 2 years at cpha.ca/contest. And we're actually gearing up to launch the 4th iteration of this contest again this coming fall, so stay tuned. Just a few quick housekeeping notes. If you have any questions for our presenters today or technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions and our presenters will have the opportunity to answer them. And if you click on the raise hand button, it's really difficult for both myself and our presenters to see. So we do strongly suggest typing questions into the Q&A box if possible. If you're unable to do so, I know this might not be the case if you're tuning in via phone, but please just hang on to your questions and send me an email afterwards, and I'd be happy to connect you with our speakers and get your questions answered. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a few days after the end of this presentation, and presentation slides will also be circulated. Lastly, we would love to get your feedback, so after the webinar, please fill out our 5-minute survey, which will open automatically in your browser once you close Zoom. This feedback really helps to make these webinars what they are and give us a better sense of what IDCC topics you would like to learn more about. Now, I would like to introduce our speakers for today's webinar. Artem Sergeyev is a public health inspector at KFLNA Public Health, a local public health agency in Eastern Ontario. He has completed a Bachelor of Environmental Public Health degree at Conestoga College. His background incorporates research and teaching activities along with practical work in different areas of public health. These areas include food safety and food processing, water safety, infectious disease control, healthy living environments, risk assessment, data analysis, health education, and health promotion. Artem's previous experience being a part of the vector-borne disease surveillance team at Windsor-Essex County Health Unit was the main motivator and basis for conducting this research. Christy Lalonde is a dedicated public health officer employed by the Government of Nova Scotia Department of Environment and Climate Change. Christy holds a bachelor's degree in environmental public health and a biotechnology diploma from Conestoga College, demonstrating a multidisciplinary understanding to health and science. Christy has worked as a public health inspector at the region of Waterloo and the region of Peel. During the challenging times of the COVID-19 pandemic, Christy played a crucial role in the pandemic response by serving as a COVID-19 contact tracer. And with that, I will turn it over to Artem and Christy.
Thank you so much, Maddie. Hello, everyone. Thank you for visiting our webinar. Christy and I were working on this topic in 2021 and 2022 during our final year in the Bachelor of Environmental Public Health program at Conestoga College. The results of this project were published in the Environmental Health Review Journal, and the information we are going to present today is primarily what you can find in that article, with a bit deeper diving into some sections such as background, methodology, and results. And if you have any questions, we will be happy to answer them at the end of the presentation. First, let me present the outline of today's webinar. We will start with an introduction and background, moving forward to our research question and methodology. Then we will present the results with interpretation, and we will wrap up with limitations and conclusion. I will turn it over to Christy now so that she can start with the introduction.
You. Okay, so vector-borne diseases are human illnesses caused by parasites, viruses, and bacteria transmitted by vectors. Vectors are living organisms that can transmit infectious pathogens from animals to humans or between humans. Most of these vectors are blood-sucking insects, primarily mosquitoes and ticks. Vector-borne diseases make up a significant percentage of infectious diseases and deaths worldwide. In Canada, vector proliferation is normally limited by the cooler climate. However, as climate change drives increasing annual temperatures, including winter temperatures, parts of Canada will likely become climatically suitable for vectors, increasing the risk of vector-borne diseases, including exotic vector-borne diseases, to Canadians. The impact of climate on vector-borne diseases can vary in severity from area to area. In particular, the Windsor-Essex County area in southern Ontario has seen significant changes in vector-borne diseases compared to some other parts of Canada and Ontario. Given the potential risk for vector-borne diseases in this area, it is necessary to understand the climate conditions and changes and how they impact the spread of vector-borne diseases. Vector-borne diseases account for more than 17% of all infectious diseases, causing more than 700,000 deaths annually worldwide. West Nile virus and Lyme disease are significant public health concerns in many parts of Canada. West Nile virus continues to be the leading cause of mosquito-borne disease in Canada, and Canadians also face an emerging risk of Lyme disease due to the northward expansion of the black-legged tick, Ixodes scapularis. In Ontario, a range expansion of the black-legged tick has been observed since the 1990s and is projected to continue, likely driven by climate and changes in land use. Additionally, there are concerns regarding the further spread of West Nile virus vectors in Canada and increases in West Nile virus cases due to climate change. Lyme disease has been a disease of public health significance in Ontario since 1990 and continues to be an issue. In the early 1990s, only one area in Ontario, Long Lake Provincial Park, was identified as a Lyme disease risk area. Currently, several areas in Ontario have been identified as Lyme disease risk areas, including many regions of southern Ontario. Since the first human case of West Nile virus was reported in 2002, Ontario has reported cases of West Nile virus every year, with 2 epidemics in 2002 and 2012. Over time, more health units within Ontario have reported West Nile virus cases. In 2017, 27 out of 36 Ontario public health units reported a confirmed or probable West Nile virus case, with rates highest in Windsor-Essex County. Vector-borne disease behavior resembles a boom and bust pattern in Canada, with periods of high human cases and positive pools followed abruptly by periods of low human cases and positive pools. This behavior has been attributed to the effects of weather on mosquito life cycle and West Nile virus transmission. In 2007, 2,215 human West Nile virus cases were reported in Canada, with the majority coming from the prairie provinces. At the same time, the winter of 2007 was milder, while the spring was warmer with increased precipitation, creating the ideal climatic conditions for the Culex tarsalis, the primary vector for West Nile virus in the prairies. In Canada, in 2010, 5 West Nile virus cases were reported, compared to 2012, where 428 cases were reported. The summer of 2012 was unusually hot, which may have contributed to the increases in West Nile virus transmission by the main vectors in Canada, the Culex pipiens and the Culex restuans. Another spike in West Nile virus cases occurred in Ontario in 2017. The winter of 2016 and 17 saw temperatures above historical averages, followed by average spring temperatures, but early summer temperatures. The combination of these factors contributed to the increased number of West Nile virus positive mosquitoes. The warm winter temperatures enabled the Culex mosquitoes to survive the winter, meaning there was an increased number of West Nile virus positive mosquitoes in the spring and summer to start the transmission cycle. In addition to traditional mosquito vectors, the pipiens and the Restuans, many new invasive vector species have been found in southern Ontario. Specifically, in the Windsor-Essex County, the invasive mosquito species Aedes albopictus was detected in 2016, 2017, and 2018. And Aedes aegypti, another invasive species, was detected in 2017 and 2019. Vector-borne diseases are susceptible to climate change and changing weather patterns because mosquitoes and ticks' life cycles are significantly impacted by temperature, precipitation, and humidity. Climate change influences vector-borne disease transmission in different ways. First, it reduces the egg development time in adult females, thereby reducing the time between blood meals and increasing the feeding frequency. Secondly, it reduces the intrinsic incubation time, permitting mosquitoes to become infectious faster. And finally, it increases the life of the mosquito, allowing them to feed on an increased number of people. Winter temperatures are significant factors impacting the spread of vector-borne diseases and have been noted as crucial predictors throughout the literature. Low winter temperatures prevent the mosquito species Aedes aegypti from establishing in Ontario. However, climate change is anticipated to bring milder and shorter winters to Ontario, facilitating the life cycle of exotic mosquitoes, especially in the Windsor-Essex County area where the Aedes albopictus mosquitoes have been established. The establishment of Aedes albopictus mosquitoes has been attributed to climatic changes in Windsor-Essex County, specifically increases in the annual average temperature. Rising temperatures in the area have facilitated the survival of invasive species and increased the number of vectors present. As temperatures in Canada, especially in southern Ontario, become milder, it is anticipated that many parts of Canada will become climatically acceptable for the establishment of some exotic vectors, including the Aedes albopictus and the Aedes aegypti mosquitoes. Over the last several decades, weather patterns related to climate change in the Windsor-Essex County have demonstrated some interesting tendencies. The annual average temperature was 9.2 degrees Celsius from 1951 to 1980, which increased by almost 1 degree Celsius between 1981 and 2010 to 10.1 degrees Celsius. The median number of days per year in this area with temperatures above 30 degrees Celsius was 17 days between 1951 to 1980, and 26 days from 1981 to 2010. In 2018 and 2017, Windsor-Essex County experienced 35 and 24 days with temperatures above 30 degrees Celsius. Annual median temperatures are expected to increase to 11.2 degrees, 13.1 degrees, and 15.3 degrees in the 2020s, 2050s, and 2080s, based on the most unfavorable scenario in terms of emissions. A median of 40, 66, and 95 days with temperatures above 30 degrees Celsius is projected for the 2020s, 2050s, and the 2080s. The number of tropical nights, which are nights above 22 degrees Celsius, is also expected to increase by over 10 times over the 2080s compared to the period from 1981 to 2010. And that's a difference of 54 nights versus 5 nights. And so all of this information leads us to our research question. Our research question aimed to answer the following question. What is the role of changing weather patterns due to climate change and the proliferation of invasive species responsible for transmitting vector-borne diseases to people and possible risks for the population within the Windsor-Essex County area? Here I'm going to describe the methodology that allowed us to answer the research question. For this research project, the Windsor-Essex County Health Unit active mosquito surveillance data was used from the year 2007 to 2021. Active and passive tick surveillance data was also used from the year 2013 to 2019. Most of the data was available on the Windsor-Essex County's Health Unit website, and some additional information was retrieved from the Environmental Health Department with the employees' permission for use. So as you can see on the chart, the following variables were considered dependent within active mosquito surveillance activity: the annual percentage of West Nile virus positive mosquito pools, the total number of West Nile virus positive mosquito pools, and the annual number of detected invasive mosquitoes, the Aedes albopictus and the Aedes aegypti. It's also important to mention that data related to invasive mosquitoes was only available from 2016 to 2021, since these species were only first discovered in the region in 2016. Within the active and passive tick surveillance data, the annual percentage of positive ticks for Borrelia burgdorferi from 2013 to 2019 was used due to the limited data availability. This variable was also considered a dependent variable. Data related to black-leg ticks and Lyme disease in the study area were analyzed separately from the data related to mosquitoes and West Nile virus, as the epidemiology of these two diseases due to climate change in Canada is markedly different. Human case surveillance data was also used. Specifically, the following indicators for the study period 2007 to 2021 within the Windsor-Essex County Health area were considered dependent variables. Those are the annual number of West Nile virus and Lyme disease cases and the rates of these diseases by year. This data was extracted from the Public Health Ontario website. Climate-related indicators were considered independent variables and included the following parameters from 2007 to 2021 within the study area. And those are the mean monthly minimum and maximum temperatures in degrees Celsius, the total monthly precipitation in millimeters, and the number of days per year with temperatures above 30 degrees Celsius. These specific climate-related indicators were chosen since they are significant factors impacting the spread of vector-borne diseases and have been noted as main predictors throughout the literature. It's also worth mentioning that climate data was accessed through the Government of Canada's historical weather database, and the Windsor International Airport weather station was used since it's considered the most representative of the study area due to its location. The descriptive data table was created to display independent and dependent variables with their characteristics, the mean, maximum, minimum, range, and median values. The table will be shown in one of the slides going forward. Line graphs were used to show trends in weather-related indicators for the study period. A one-way ANOVA test was performed to compare the means for independent variables for which there were medium or strong correlations with dependent variables. This method allowed us to reveal statistically significant differences in means for weather-related variables between at least two groups from 2007 to 2021. Thus, the one-way ANOVA test results demonstrated if weather-related patterns for the study period could be attributable to climate change. Active mosquito and tick surveillance data, human case surveillance data, and climate-related indicators for the study period were analyzed using Excel analysis toolpack to calculate the Pearson correlation coefficient with p-values to assess the statistical association between independent and dependent variables. The data were interpreted in the following way. A correlation coefficient of 0 indicated that no linear relationship exists. Two continuous variables and a correlation coefficient of -1 or +1 indicated a strong negative or positive linear relationship. A p-value of equal to or less than 0.05 was the criteria for a statistically significant association. For pairs of independent and dependent variables that demonstrated a statistically significant association, the simple linear regression was applied for two purposes. First, in order to measure the influence of weather-related parameters on dependent variables, And second, the regression analysis was used to predict how changes in weather indicators can affect changes in studied dependent variables. The Excel analysis toolpack was applied for linear regression analysis, and the coefficient of determination, R-square, was used to evaluate how much of the variance of the dependent variable can be explained by the independent variables. Regression coefficients were used for regression equations in order to make predictions for dependent variables. A p-value of less than or equal to 0.05 was the criterion for all coefficients and predictions based on them to be statistically significant. Line and scatter charts were applied visually to display the association between independent and dependent variables and used to assess outliers in the data. Additionally, scatter charts were used to evaluate the characteristics of the regression analysis, such as trend lines, residual plots, and normal distribution plots, which allowed us to ensure that the assumptions necessary for the linear regression had been fulfilled. So now I will move into the results of our study. So first, I'll just take a look at the descriptive data table. So this chart demonstrates variables used for data analysis with characteristics including the mean, median, range, minimum, and maximum values. The variables were selected because through the analysis, these independent variables demonstrated medium or strong correlations with dependent variables for the study period. Weather data for all months in the study period were analyzed to determine the correlation strength with dependent variables. Those that demonstrated medium or strong correlations were selected to be further investigated. The maximum January temperatures for the study period had a range of 7, with the maximum temperature of 2.9 degrees Celsius occurring in 2020 and the lowest temperature of minus 3.9 degrees Celsius in 2014. However, the maximum February temperatures for the same period had a range of 13.3 degrees Celsius, with the maximum temperature of 7.3 degrees Celsius occurring in 2017 and the lowest temperature of minus 6 degrees Celsius in 2015. Maximum March temperatures also demonstrated a significant range of 13 degrees Celsius, with the maximum temperature of 15 degrees Celsius occurring in 2012 and the lowest temperature of 2 degrees Celsius in 2014. The number of days with temperatures above 30 degrees Celsius in May had a range of 5 days, with the maximum number of days being 5 in 2007 and 2018, and a minimum of 0 in 2014 and 2015. For the total precipitation in millimeters in May, the range is 132, with the highest level of precipitation, 179.4, recorded in 2011, while the lowest, 47.3, was recorded in 2021. The annual rate of West Nile virus from 2007 to 2021 ranged from 0 per 100,000 people in 2008 to a maximum of 5.5 per 100,000 people in 2012. The range for the annual rate of Lyme disease was 2.1 during the same period, with a minimum of 0 in 2007 and a maximum of 2.1 in 2008. The number of West Nile virus positive mosquito pools from 2007 to 2021 was the lowest in 2014, with 1, and the highest in 2020, with 30. The annual number of detective invasive species from 2016 to 2022, those being the Albopictus and the Aegypti, demonstrated significant variability, with 10 in 2017 and 1,129 in 2018. Additionally, for the annual percent of ticks positive for Borrelia burgdorferi from 2013 to 2019, we saw a range of 36, with a minimum of 0 in 2014 and a maximum of 36 in 2015. So for both independent and dependent variables, we can observe different variability within the studied periods, which is especially interesting for the weather indicators. And now I am going to describe trends in weather temperatures. So this chart displays the average maximum temperatures for January, February, and March from 2007 to 2021 and trend lines for this period. The chart demonstrates that maximum January and February temperatures not only fluctuate, but have also been steadily increasing during the study period. In contrast, maximum March temperature does not show general trend changes, despite spikes in 2012 and 2016 and a drastic decrease in 2014. To compare the means for independent variables with medium or strong correlations with dependent variables, a one-way ANOVA test was performed. The one-way ANOVA test revealed a statistically significant difference in mean maximum February temperatures between at least two groups from 2007 to 2021. The steadily increasing trend line for the maximum February temperatures shown here and the statistically significant results from the one-way ANOVA suggest that the observed increase is not by chance. This result was also observed with maximum January temperatures. An increasing trend line in the chart and a statistically significant difference in means between at least two groups in the one-way ANOVA from 2007 to 2021 again suggests that the observed increase is not by chance. Regarding March temperatures, the one-way ANOVA demonstrated that there was a statistically significant difference in mean maximum March temperatures between at least two groups. This chart did not show us any trends or specific patterns for this parameter during the study period. So this chart displays the results for maximum January temperatures, maximum February temperatures, and maximum March temperatures with the respective years and corresponding indicators, the p-values, the f, and the df values between and within groups. So again, to summarize the results for trends in temperature, the one-way ANOVA revealed a statistically significant difference in mean maximum February temperatures between at least two groups from 2007 to 2021. Statistically significant differences in means between at least two groups in the one-way ANOVA from 2007 to 2021 for maximum January temperatures, and a statistically significant difference in mean maximum March temperatures between at least two groups. So this figure displays the number of days with temperatures above 30 degrees Celsius in May from 2007 to 2021. In May of 2007 and 2018, there were 5 days with temperatures above 30 degrees Celsius, while in 2014 and 2015, this parameter was 0. This research observed increasing trends in temperature in the Windsor-Essex County Health Unit area throughout the study period. Specifically, January and February temperatures and statistically significant differences between years shown by the one-way ANOVA test suggest that winter temperatures are becoming milder. These results are aligned with the findings of other authors saying that climate change was anticipated to bring milder and shorter winters to Ontario. And this tendency can be observed in the Windsor-Essex County area. These results also emphasize the necessity of further observations of temperature trends in this area over time. And now I will turn it over to Artem to discuss some of the correlations that we observed during this study.
Thank you, Christy. Now, having observed the weather trends, let's take a look at the correlations. A positive correlation with coefficient R 0.56 was calculated between maximum January temperature and the number of West Nile virus positive pools from 2007 to 2021 with P 0.03, meaning that with the increase of maximum temperature in January, the number of West Nile virus positive pools also increased. Most of the increases and decreases in maximum January temperature are aligned with the spikes and drops in the number of West Nile virus positive pools, as we can see in the chart. Now let's take a look at the regression model for this pair of variables. First, R square, or the coefficient of determination, shows us that the variable maximum January temperature explained 31.4%, almost 1/3 of the variance from the dependent variables, the total number of West Nile virus positive pools. The p-value of 0.03, the same that was used for the assessment of the correlation coefficient, allows us to say that the effect of maximum January temperature on a number of West Nile virus positive pools is statistically significant, as it's less than 0.05. We can also see that two regression coefficients are presented on the chart. Intercept, which is equal to 15.35, Intercept means that when the independent variable, which is in this case maximum January temperature, is equal to 0, the value of the variable total number of West Nile virus positive pools is 15.35. The second correlation coefficient is called a slope and is equal to 0 to 2.08. It means that if the value of the variable maximum January temperature changes by 1 unit, the value of the variable total number of West Nile virus positive pools changes by 2.08. And we can see that p-values for both of these coefficients are less than 0.05, which means that they are statistically significant. Here you can see the scatter chart for these two variables with the trend line and the regression equation. The slope and intercept are included in the equation, and we can use them to predict the number of West Nile virus positive pools, which is y in the equation, based on any value of the independent variable, which is x in the equation. But the main information from this equation is that if the value of the variable maximum January temperature changes by 1 unit, the value of the variable total number of West Nile virus positive pools changes by 2.08. Also, we can see that predicted values of the dependent variable number of positive West Nile virus pool are presented as orange dots on the line, and they are different from the real values we received, which are blue dots. Which is always the case. These differences between actual and predicted values are called residuals, and they will be presented on the next slide. What I wanted to mention here as well, when it comes to assumptions that are necessary for linear regression analysis, it's important to evaluate the linearity of the relationship. Here we can see that even though the line doesn't perfectly represent all points on the chart, the relationship still can resemble some linearity. Regarding other important assumptions for this method, one of them is called homogeneity of variance. On the left chart, we can see residuals, differences between actual and predicted values. We can see quite a random pattern of the residuals on the chart. We have approximately half of the number of data points above 0, and other half are below 0. And the variance of these residuals looks quite constant over the predicted values. Thus, we can say that the homogeneity assumption for this regression model has been fulfilled. And one more assumption for the model is that the residuals are supposed to be normally distributed. On the right chart, we can see the graphical method of distribution assessment called QQ-plot. Based on this chart, we can see that data residuals are normally distributed, which means that this assumption has also been fulfilled. Thus, observed tendencies for these two variables obviously indicate an increased risk for West Nile virus with warm and winter temperatures. These results align with some other authors who found that January and February temperatures can be relevant predictors for West Nile virus cases in the southern part of Ontario, as winter temperatures significantly impact the ability of mosquitoes to overwinter. In warmer winters, West Nile virus positive mosquitoes will survive and start the infection cycle earlier in the season. But let's take a look at another pair of variables where the independent variable is also related to winter. Similarly, a positive correlation was found between the maximum February temperature and the annual rate of West Nile virus for the period from 2007 to 2021, with R equal to 0.62 and P 0.014. This means that with the increase in maximum temperature in February, the annual rate of West Nile virus also increases. The majority of increases and decreases in maximum February temperatures aligned with spikes and decreases in the annual rate of West Nile virus, as we can see in the chart. Similarly to the previous pair of variables, let's take a look at the regression model for this one. First, R square shows us that the variable maximum February temperature explained 38.5% of the variance from the dependent variables, the rate of West Nile virus. The p-value of 0.014 allows us to say that the effect of maximum February temperature on the rate of West Nile virus is statistically significant. We can also see that the intercept is equal to 1.22 and the slope is equal to 0.32. It means that if the value of the variable maximum February temperature changes by 1 unit, the value of the variable rate of West Nile virus changes by 0.32. And we can see that p-values for both of these coefficients are less than 0.05, which means that they are also statistically significant. The scatter chart for these two variables is presented on the slide. The slope and intercept are similarly included in the equation, and we can use them to predict the rate of West Nile virus, which is y in the equation, based on any value of the independent variable, which is x in the equation. Similar to the previous pair of variables, we can see linear looking trend for this model, which is one of the assumptions for the regression analysis, as was mentioned before. Regarding the homogeneity of the variance, if we look at the left chart, we can see residuals, differences between actual and predicted values that are also located quite randomly throughout the graph. However, homogeneity for this regression model is less distinct compared to the previous pair of variables. And regarding the distribution, we can see on the right chart that data residuals are normally distributed, which means that this assumption has been fulfilled. Thus, similarly to the previous pair of variables, the observed relationship between the maximum February temperature and annual rate of West Nile virus indicates the importance of winter temperatures, especially January and February maximum temperatures, in prediction of risks of West Nile virus for the population during the upcoming season. Now, let's look at the role of warmer months temperatures in the spread of vectors. A strong positive correlation, 0.85, was calculated between the number of days in May with temperatures above 30 degrees Celsius and the total number of Aedes albopictus from 2016 to 2021, with p equal to 0.033, meaning that with the increase in the number of hot days in May, the total number of Aedes albopictus also increases. Here, I would like to mention that while we were preparing for this webinar, we checked some updated information from Windsor-Essex County Health Unit website that wasn't available at the time when we were doing this project. Thus, now we have data for one more observation, which is obviously for 2022. Surprisingly, we didn't find a significant correlation between these two variables after adding data for one more year, probably due to the fact that there were very few hot days in May during the last several years in the area. However, we decided to check the correlation and regression between a similar variable, which is the mean maximum May temperature and number of Aedes albopictus, and we will see the result on the next slide. Here we can see that correlation coefficient between the mean maximum May temperature and the total number of Aedes albopictus is equal to 0.80. Coefficient determination is 0.646. Thus, the variable maximum May temperature explained 64.6%, which is almost 2/3 of the variance from the dependent variable, the total number of Aedes albopictus. The p-value of 0.03 allows us to say that both coefficients are statistically significant. The intercept and slope for the model are presented at the bottom of the chart, and we can see that they are both also statistically significant. The scatter chart for these two variables is presented on the left side of the slide. The relation between the variables looks linear. According to the equation, if the value of the variable maximum May temperature changes by 1 unit, the value of the variable total number of Aedes albopictus changes by 188. Charts for the homogeneity of the variance and normal distribution assumptions are presented on the right side of the slide. The relationship between these two variables, maximum May temperatures and total number of Aedes albopictus, is quite interesting. This is likely attributed to the mosquito life cycle being significantly impacted by temperature. As we know, cooler temperatures have played an essential role in limiting the spread of invasive vectors in Ontario. However, as temperatures in Windsor-Essex County become milder, this area is becoming climatically acceptable for the establishment of the invasive vector Aedes albopictus. Increasing May temperatures could lead to a longer duration of climatic suitability for disease transmission. Warmer May temperatures extend the duration of summer weather, facilitating Aedes albopictus life cycle by supporting larval development and probably survival. and extending adult lifespan, encouraging larger populations of these vectors in summer months. These findings suggest that maximum May temperature can be used as a predictor for the number of detected Aedes albopictus and therefore can be used for the risk assessment as well. Let's now look at one more interesting finding. A negative correlation minus 0.62 was found between the maximum March temperature and the annual rate of Lyme disease from 2007 to 2020 with p equal to 0.018. This means that with the increase in maximum temperature in March, the annual rate of Lyme disease decreases. As we can see in the chart, most of the spikes in maximum March temperatures correspond to drops in the annual rate of Lyme disease, while decreases in temperatures align with increases in the Lyme disease rate. Back in 2021, we were thinking a lot about this interesting relationship, trying to find possible explanations in literature. It looks like warmer March temperatures might directly or indirectly create unfavorable conditions for ticks. We thought that it could be attributable to the complexity of the relationship between ticks, hosts, and weather climate indicators. One of the potential explanations was that the density of host species, including the white-tailed deer and white-footed mice throughout southern Ontario, could have been affected. But once we recently added data for the 2021 year to the data set, we no longer had a statistically significant correlation. This is not very surprising since this correlation wasn't really aligned with any logical explanations. Nevertheless, this specific example is still useful as it shows the importance of increasing the observation periods within any future projects related to this topic in order to further increase the reliability of data sets and the accuracy of results. And now is the best time to go through our least favorite part of the presentation, limitations. The first limitation of this research is incomplete data sets for certain dependent and independent variables. The annual percentage of West Nile virus positive mosquito pools was available only from 2013 onwards. Data on Aedes mosquitoes have only been collected for 7 years, from 2016 to 2022. And some of the weather data from governmental sources were also incomplete. However, it's worth mentioning that even for some variables with limited data, statistically significant correlations with other independent variables were observed, and absent weather data was so rare that it actually didn't affect the results. Additionally, when examining Lyme disease cases, there is a possibility of a long delay between people's exposure to tick bites and the date the disease is reported, which could diminish the actual correlation between this variable and any independent variables that were included in our research, which requires further analysis that would take these types of delays into consideration. Even though for some of the presented variables we saw something that can resemble a linear relationship, in many cases the relationship between weather-related factors and vectors' life cycle and behavior patterns is not linear. For example, there is obviously a threshold for summer temperatures when temperature spikes at some point will become detrimental for vectors. Thus, we need to be careful with the interpretation of the results due to this factor, and statistical methods for nonlinear relationships probably should also be utilized, especially if similar studies will be conducted sometime in the future for the longer period of observations, which of course would be very interesting to see. To conclude, the results of this study show important tendencies in weather patterns related to climate change, as well as relationships between some weather indicators and variables that may be attributable to high risk for populations in terms of vector-borne diseases. Climate change may significantly impact the proliferation of invasive species responsible for transmitting vector-borne diseases to people and possible risks for the Windsor-Essex County area. The climate in Windsor-Essex County is clearly becoming more suitable for the establishment of exotic vectors and their diseases. In this study, increasing maximum January and February temperatures demonstrated a positive impact on the number of West Nile virus positive pools and annual rate of West Nile virus, respectively. January and February temperatures can be relevant predictors for West Nile virus cases in the southern part of Ontario. As we already know, winter temperatures have a significant impact on the ability of vectors to survive further during the spring, and in colder years, effective overwintering of mosquitoes tends to be decreasing. Another significant factor was the maximum May temperatures that demonstrated a significant effect on the increase in the total number of Aedes albopictus. Thus, there may be an increased risk of vector-borne diseases to the residents of Windsor-Essex County due to the climate change, with significant factors being warming temperatures and, in particular, winter temperatures. Given the results of this study, Windsor-Essex County Health Unit and other health units might want to consider adapting their vector-borne management strategies and risk assessment tools to include parameters such as maximum January, February, and May temperatures. These parameters can help health units assess expected in the area number of West Nile virus positive mosquito pools, the annual rate of West Nile virus, and the total number of Aedes albopictus, where it can be applicable for the upcoming season. Additionally, health units can use this approach to communicate risks timely and more intensively to local residents during seasons that are identified as high risk. We also hope that the results of this small project, along with other available information on this topic, can be used for a deeper and more complex analysis of the issue in order to further develop and improve tools that are specifically designed for the assessment of risks related to vector-borne diseases, not only for Windsor, but for other areas within Ontario and Canada as well. And we are coming to the end of our presentation. This slide and the next one are references. At the end, before we move to the questions, we would like to thank Wendy Pons, Amandip Hans, and Philip Vaughan for their assistance with this project. And thank you everyone for your attention. Now we will be happy to take any questions.
Wonderful. Thank you so much for your presentation, Artem and Christy. Like Artem said, at this point, if you have any questions, please submit them using the Q&A box at the bottom of your screen. And maybe I will start working off of, I know, Artem, you went into some limitations of the work, but did you run into any major challenges when you guys were working on this project?
Regarding challenges, it's a research project is always challenging. So
yeah.
Difficult to say specifically about any challenges, but in general, I think, and Christy would agree with me, it's important to determine the proper statistical method to answer the research question. It can be challenging to grasp all necessary references and literature that would be relevant and look through it and to do research, analyze everything, and then to put everything together to see the whole picture. And another challenge I think we were considering, we were not limited by specific vectors like mosquitoes or ticks. We wanted to consider both like sides of this issue. And as it was mentioned before, there are some like significant varieties between these two types of species. So it also was a kind of challenge, but like teamwork helped us to achieve some goals, and hopefully it was helpful and useful.
Yes, definitely. Yeah, I know that ticks and mosquitoes, especially in Ontario, are major vectors to consider. But keeping in mind that some of our audience does come from across Canada, not only Ontario, could the findings from your work be applied to other regions or other regions in Canada, or kind of Canada more broadly?
Technically, I believe it can be applied, but before they can be applied, I would do some preliminary maybe study or observation, because most of the health units in Ontario and within Canada in general, I believe they have some data available based on their history of active tick surveillance. Some health units I know they did passive tick surveillance when people were able to bring some ticks for analysis. So many health units, I believe, stopped doing that, but some data can be still used historically. And I believe when some general tendencies are determined, the similar approach with a similar formula can be used, taking into account specific varieties when it comes to specific species, and maybe any kind of unique climate or weather-related indicators that for sure need to be taken into account, because Canada is a huge country, so it's also be a variety that need to be considered.
Yeah, wonderful, wonderful. Thank you. And we do have some questions coming in. What do you think are the needs for future studies looking at ticks and weather?
Like we mentioned, first, I think it's important to extend the, like make it more long-term observations with bigger data sets, with longer observations, to be able to get more accurate and reliable data sets. And I believe it was mentioned in several articles that we were reading through, that One Health approach, which is becoming more and more common and spread throughout the Canada and internationally, I believe. This is something that can be utilized effectively to further do further research in terms of interaction, not only between vectors and weather and climate change, but also between hosts, different species of animals. And these hosts and animals also can be affected by climate and weather factors. And this is especially important for ticks, because ticks are dependent on like hosts that they facilitate their spread. And this is also important factor that needs to be needs more research, I believe. Christy, would you like to add something to that? Sorry, I'm just took all questions.
No, I think that's a good answer. Just I think bigger data sets is more important. So looking at it more on like a bigger scale, because we did focus on sort of just Windsor as we were limited, but having more data available, and it could help us better understand some of the trends that we observed and sort of provide more of a detailed explanation for that. I think that would be a good future study.
Yeah, and one thing that also came to my mind is that combination of factors, all factors, even like within weather conditions, or again, when it comes to environment, the most challenging part of answering research questions like that is to determine the role of each factor separately and how they can be affecting each other. And a combination of these factors is something that I believe requires more sophisticated statistical like analysis and deeper research with a longer period of observations.
Definitely, yeah. And what is the population numbers in your catchment for this data? If you can remember off the top of your head.
A population number in terms of vectors or population?
I'm not sure if the attendee can clarify, but I'm assuming it's just the population numbers in terms of kind of like people in your catchment area for the data. That's what I'm.
Yeah, when it comes to cases among people that we will use, like rate of West Nile virus, it was just data in terms of like per 100,000 people, like typical incidence rate of disease. If we consider specifically positive mosquito pools, we were dealing with rate of positive mosquito pools and the number of positive mosquito pools. It was quite difficult because, again, some data wasn't available to us, and at some point we were just relying on a number of pools, not the rate, which is also valuable information. And it could be varying from like 5 pools per season to almost 30. So when it comes to specifically like vectors. Yeah, but when it comes to people's population, it's primarily data from Public Health Ontario website, and they just calculated for 100,000. I hope.
Wonderful. Yeah, and if I interpreted that question wrong, and if you're the attendee, please feel free to send me an email and clarify the question. I'd be happy to forward it along to Artem or Christy. We do have another question coming in. Did you do any analysis on the effects of precipitation on number of mosquitoes, number of positive pools, or other outcomes?
Yeah, thank you for the question. We did, but as obviously, since we didn't include anything specifically about precipitation, we were not able to find really significant correlations or tendencies, even though, of course, obviously there are some. For example, if it's, again, here is a challenge with a linear relationship, at some point precipitation can be beneficial for vectors, especially for mosquitoes, but when it's too much, it's a rainfall, as they can be like washed away completely, it can be detrimental. With ticks, it's like less prominent maybe, but when it comes to humidity, it's also important factor that can contribute to the development. But I believe for precipitation, we I didn't find anything specifically, maybe because precipitation is really, really closely related to other factors, and specifically for these parameters, more complex methods would be helpful. Or maybe we just didn't have, I believe we just didn't have significant varieties of precipitation, most likely within the study period of time, and longer observation would be helpful. But obviously, of course, the role of precipitation is also quite significant.
Wonderful, thank you. And we did have an attendee comment. If it helps, Windsor-Essex population in 2021 was about 422,000. So good to know. Thank you, Scott.
Okay. Oh, it was a question about population. Okay, yeah. Thank you.
Yeah.
I was thinking about vectors.
No problem. When it comes to surveillance, should more health units consider extensive surveillance, such as setting up OVI traps and BGS traps, as climate change is now on the rise?
These traps, since I was working with them, it's really interesting experience, and I think it would definitely make sense. But first, it's supposed to be done like based on risk assessment. So Windsor-Essex County Health Unit started these traps like a few years ago. I think it's 2016. And it made sense. So also we can see some articles that mention about like spread of this invasive species to other, unfortunately, to other health units areas. And I believe we're in the process when more health units will be utilizing them for like monitoring and risk assessment. And but first of all, I think we need to evaluate again during the last few years trends, tendencies, changes in numbers, and then it could be applied for sure.
Yeah. Christy, do you have anything to add coming from, I know, region of Waterloo and then now being out east?
I was just gonna say, like the risk assessment piece is really important because it might not be necessarily for every area, but certainly areas that might be more vulnerable to exotic vectors should consider doing more extensive surveillance, because that was sort of one of the things that we wanted to look at was how can we assess the risk, and these parameters could help. So it might be necessary for some places to do more extensive surveillance, while for others maybe not yet. But yeah, I don't have experience working with those traps as Artem does, but yeah, I think that's all I would add to that.
Wonderful. And there's tons of comments coming in from attendees on great presentation, great work. And we do have one last question coming in. When it comes to surveillance, how would you address biases due to samples usually representing densely human populated areas and not a comprehensive representation? And I know that was a long question, so I can repeat it if you like. When it comes to surveillance, how would you address biases due to samples usually representing densely human populated areas and not a comprehensive representation?
Yeah, because definitely it can be challenging when it comes to again statistical analysis and transferring data to like general population. Again, more observations, more sophisticated and accurate statistical analysis tools that specifically apply to the data set that we have and taking into account all factors. This is the only way how we can deal with that. And the more observations we have, the more accurate data we will receive to like deal with lack of units of research.
Mm-hmm. Okay, one last. Oh, sorry. Go ahead, Christy.
I was just gonna say, I think also with sampling, sometimes there can be restraints in terms of like a capability of doing it with maybe budgets. That might be one of the reasons for the bias. So sometimes overcoming that challenge might help reduce some of that bias. But
And we do have a comment from Scott, who works on mosquito surveillance in Windsor-Essex for the health unit. He says, knowing how to assess the effect of precipitation on number of mosquitoes and number of positive pools has been very tricky. So suggestions are welcome. But I know you said the same thing, Artem. Yeah. Wonderful. Well, it's 1 p.m., so that does bring us to the end of our webinar. Thank you everyone for joining us, and thank you so much, Artem and Christy, for taking the time to deliver this wonderful presentation. The next webinar in our series is on Tuesday, October 24th, and it's titled Emergence of Canine Leptospirosis in the USA and Canada, Impacts of Dog, Community, and Environmental Drivers. So we hope to see everyone there. Thank you so much. Have a wonderful afternoon, everyone.
thanks,
Thank
everybody.
you.